Dr. Irshad Ali Shaikh from Ankara, and he is the Health Security Lead and Interim Head at the WHO here in Turkey. Great to speak to you again. First of all, we saw those numbers falling quickly here, which was a great relief to everybody. But now, as I just said, stubbornly they're stabilising, these new infections stabilising very stubbornly. Why?
Well, thank you. Good afternoon, and thank you for giving us the opportunity. And I think that's a $6 million question on everybody's mind. Why aren't we seeing decline further onwards? And the reason is that with this outbreak and this disease, we have seen that maybe 1 in 4, 1 in 5 may be asymptomatic. So while it's easy to identify those who are confirmed cases, positive tests with symptoms or mildly symptomatic, and trace their contacts and contain the transmission chain, but it is those 1 in 4, 1 in 5 which are asymptomatic that are still able to pass on the virus. So this will be the most difficult part for Turkey and for any country for that matter to address through social distancing, hand washing. In country, we have mandatory masking. Many other countries are doing that. So these are the measures of social responsibility that will reduce, but slowly, this remaining recalcitrant load of 1,000 plus that we are seeing in Turkey. But we must remember that there was a time when we had 4,000 plus cases every day, and we have reduced by over 75% now to about 1,000 on average on a daily basis.
Absolutely. It is amazing what's happened in Turkey. But are there any patterns that you can see emerging regarding who is getting infected right now?
I think this applies to Turkey and globally. We are seeing that elderly are at the highest risk. Those with comorbidities, diabetes, hypertension, heart disease are at the highest risk. But in Turkey, we have seen remarkably low mortality in elderly, despite being the highest group, because of multitude of measures by the government and their preemptive application. And we were also able to ward off the disease entry into Turkey for over 10 to 12 weeks, which gave us the invaluable time to be prepared and be ready for it. In terms of pattern, what we are seeing is that men are more likely to die out of it. Those who are vulnerable, disadvantaged, marginalized are more likely to die out of it. And also, of course, elderly, like I talked about. But in case of Turkey, we have seen worst outcomes in terms of health in this disease across the board. So I think that it speaks volumes in terms of the country achievements. But at the same time, it doesn't mean that those who are in other age groups are not at risk. It's because we have been successful through the measures we have implemented: risk communication, community engagement, social distancing, hand washing. They've been successful. And this is the time that we should not lose our attention and focus on this, because this virus has the potential to come back with a vengeance and hit us hard when we least expect it.
And that is very, very scary indeed. And the question about that, we saw a hospital inaugurated today in Istanbul for a potential second wave. How likely is that?
Well, I think nobody has the magic sort of ball to see when it is, but the global consensus is that we are likely to see in the fall the second wave. But before that, I must also emphasize that we can also see a second peak in the first wave as the government relaxes measures, if as the community we do not exercise the social distancing, hand washing, and all the measures that we have successfully implemented. Another factor that's going to add very soon is opening of international tourism, medical tourism. So as government and authorities will also need to focus on importation of cases, so at points of entry through international health regulations, application of strict surveillance measures will be extremely critical to keep the cases low so that we do not see a second peak in the first wave. And of course, in the fall, and again, the worst commonality there is the flu season of starting in September in the fall also. So addressing flu vaccination, community engagement, community awareness that not every flu symptom equals COVID-19. So a lot of work is still ahead of us for public health professionals, government authorities, and community key informants, community itself, looking forward in the fall.
Before I let you go, June the 1st. That is a date that has brought a big smile to many people here in Turkey. The day that a lot of measures will be eased. Your top tips, please, before you go.
Social distancing, hand washing, not to protect yourself, but to protect your family, loved ones, and friends. Their protection depends on you. So it's our moral, ethical, communal responsibility, civic duty to make sure we, even when we are healthy, we observe all these measures to make sure we keep each other protected from this virus.
Beautifully put. Dr. Irshad Ali Shaikh speaking to us from Ankara, from the WHO in Turkey. Thank you so much.